Before you treat a disease, the first thing we are going to do is let us find out what is wrong with this person. If we find out what is wrong with this person, we have actually make a diagnosis. Then the next question that will now follow it is this something that we can cure or is this something that we have to manage? When you come to the hospital with a condition, endeavor to ask the doctor, in a treat, in a manage. I don't know if you understand. There is a curative tendency, just that we want to cure this thing and let it go. There is some diseases we cannot cure, but we can make sure that the disease does not affect the life of the person we are. Let's take an instance. If somebody comes and do some blood tests and we realize that this person have malaria, our major focus is that we want to treat this malaria It doesn't mean you should continue on anti-malaria all the time, because this thing is purely curative tendency. We want to treat it. On the other hand, if somebody comes around and that person have hypertension or that person now have diabetes, it is not for you to treat it to go. No, it is for you to bring it down. So it's actually a kind of management. But that's notwithstanding, before we come and say we are managing this condition, managing the condition simply means that this person has to be on drug every day. Do you understand what I'm saying? Now, if you are managing this condition, we will not just come and say, BP or what to 120. The answer is yes. You continue taking it. Now, if a person comes to the hospital and you check the blood pressure and it's high, we will not start the person on drugs immediately. The number one thing we are going to check is what is the age of this person. If somebody of 30 years come to the hospital and you check the blood pressure, it is high. You consistently check the blood pressure, it is high. That is the time for you to go and check what is causing this blood pressure. Because BP, as the name is, all into two types. We have primary hypertension, we have secondary hypertension, or you can call it essential hypertension and non-essential hypertension. In essential hypertension, it usually occurs in elderly people. I don't know if you understand. By the time you look at it and say, this is occurring in elderly people, the idea is there might be no other thing causing it. But in secondary hypertension, which usually occur in younger people, less than 30, less than 40, when you see somebody less than 40 and that person is having high blood pressure, it might likely be a secondary hypertension, meaning that there is something causing that hypertension. So in that case, we might not want to manage the hypertension. What are we going to do? We want to treat it. Because by the time you remove what is causing that hypertension, the BP will go. You don't need to be on drug all the time. You understand what I'm saying? So the idea is now for us to know, is this something that we can treat or something that we can manage? If it's something that we can treat, you treat it and the person go home. Now, if it's something you can manage, let's assume somebody have diabetes. We know that most times, so that's when we have what you call honeymoon period and type 1 diabetes, most times these people has to be placed on drugs for life. What are we doing in that thing? We are just managing.